All righty, we are live. Hi, everyone. Good afternoon or good morning, depending where you are in the world. We're going to give it just another second or two to let people hop on, and then we will get started. This is going to be a quick one, so we'll make this little intro very quick. Quick, but super informative, right, guys? It should be good. Hi, Stephanie. Good afternoon. Thanks for joining us. And Catherine, good afternoon. Okay. Looks like we've got a good amount of people, so let's go ahead and get started. Thank you all for joining us today. I am so excited to have Jill and Judy back. This is our final part of the brain injury training series that we've hosted with them. I am Hannah, Director of Marketing at TCare and DAV Caregiver Support, and we're super excited to have you guys for this final series. And we're especially excited to have Jill and Judy on today. They are with the National Association of State Head Injury Administrators. They bring so much knowledge and experience in the brain injury space, and we have been so thankful to have them throughout this series. And this is definitely not the last time that you'll see them collaborating with us. Just a little housekeeping. Feel free to put any questions or comments in the chat or the Q&A. And then afterwards, we will be sending out a follow-up email with the recording and any resources or links that you guys see in the presentation today. So Jill and Judy, feel free to take it away.
Thanks very much, Hannah. We are really excited to be here, Judy and myself. We're from the National Association of State Head Injury Administrators, and we'll tell you just a little bit more about that. And I'll mention who I am. I'll ask Judy to talk a little bit about herself and then ask you all to share with us a little bit about you. My name is Jill Farrington. I'm again with NASHA. I'm our Director of Community Integration. We do a lot of programming around the country to improve brain injury supports, which we'll talk about again in a few moments. While I'm turning it over to Judy, please note on the slide that we're inviting you to let us know about you, who you are, your name, first name is just fine. We are interested a little bit in the state that you've joined us from, who you care for, if that's applicable for you in your role. And then if there's anything that specifically you're hoping to get out of the session, please feel free to share it. Judy, would you like to introduce yourself?
Sure. Hi, everybody. Thanks for being here today. We're excited to talk with you. I'm Judy Detmer. I'm Director for Technical Assistance and Special Projects at the National Association of State Head Injury Administrators, NASHA, as Jill mentioned. Been working in the field of brain injury for a long time, over 30 years, and really excited to talk to you all as an important piece to the puzzle of supporting people with brain injury. And Jill, I'll turn it back to you.
Okay. So you may or may not have heard of our organization before. We are a national nonprofit, and as I mentioned earlier, we work closely with state governments and their lead agencies on brain injury, as well as their partners and others around the country to make sure that the quality of life for people with brain injury continues to improve with the right kinds of supports and systems. We do a variety of interventions along the lines of what you see on the screen. We develop resources. We are very involved with training as we are with you all today. We work closely on making connections between various state agencies and others that when collaborating may find ways to really, like I said, improve the infrastructure, improve the capacity for serving people with brain injury. We stay on top of state and national trends, and we are also very involved with advocacy at the federal level, working to protect and improve services for people with brain injury. So today's objectives are the three that you see on the screen. We really do want to dive into the unique aspects of brain injury, specifically among veterans, because we know that's the kind of the world that you come from. We know also that it's important to understand the overlap between brain injury and post-traumatic stress disorder. So we will be talking on that topic and giving you all targeted strategies to support the veterans that you support as caregivers, and empowering you to know when you know that brain injury exists, that you might want to be seeking more help, or, kind of looking at the next level of supports that might be helpful for you. So why do we want to do this topic? We've been talking with our partners at TCare for, the last several months, and we know that as caregivers, it is very important to understand brain injury and the symptoms that are at play, because sometimes there's not a diagnosis and we need to understand more subtle symptoms. When we do so, we can sometimes understand what might be something that's a little bit more temporary versus what might be more permanent. We can then understand a little bit more about what we're seeing and sometimes the complexities that are involved, and then really work towards providing people with empathetic support that helps people with their daily lives and encourages recovery. We know that when we better understand brain injury, that we're able to communicate more effectively with people that struggle with brain injury symptoms. And that overall, when we do this kind of work together, that ideally we're lowering the stress on caregivers by creating that stronger understanding. So I'm going to, at this point, turn it over to Judy to take us into our content for today.
Great, thank you, Jill. This is just a really brief session, so we will cover kind of the highlights of brain injury and things to know. Just know that we're available if anybody wants to learn more. We can direct you to supports in your own states, whatever it is that you want, we're here for you. So just real quickly to make sure we're all on the same page when we talk about brain injury. Oftentimes we hear the term traumatic brain injury, and that's specifically what we hear often when we're talking about vets and veterans who have served with brain injury. But we like to talk about brain injury more broadly. And so that term is acquired brain injury. That's the umbrella term. Under that, we have traumatic brain injury, which again, most of you are familiar with. Those mechanisms of injury include external forces to the head. So things like assaults, falls, particularly with our veterans, we're looking at blast injury, motor vehicle accidents. So that's traumatic. And then non-traumatic brain injury is a little lesser known in some circles, but that is an internal event that causes a brain injury. Those can be things like stroke, brain tumor, lack of oxygen to the brain, or prolonged infection. And so just know we're kind of using the terms a little interchangeably, but acquired brain injury is the way we like to approach brain injury. And one thing I'll just say here too, before I go into more about prevalence, is that oftentimes people may not even be diagnosed with that brain injury, especially again, as we think of a veteran population. If there's polytrauma, multiple traumas going on, they might be addressing the more acute trauma, such as, or recognizable trauma, such as broken bones or different things like that, versus tuning into the fact that someone may have had or sustained a brain injury or concussion. So as we're talking, just know that you may be supporting someone, or someone that you know may be supporting someone who maybe has an undiagnosed brain injury. And hopefully as we learn signs and symptoms of brain injury, you can start to recognize that. Go to the next slide. So getting into prevalence though, before I get into any of the data, just kind of want to talk about brain injury and the chronicity of brain injury. We used to think of brain injury as like a single event that then someone recovers from. Unless they had a severe brain injury, medically severe brain injury, like they were in a coma, then it was expected they would have long-term concerns and lifelong disability related to brain injury. And what we're finding is that brain injury really is a chronic condition in a few ways, not only for those who sustain more of a severe brain injury, but those who have had multiple mild brain injuries. So again, thinking about those who have served or been in combat, those subconcussive blows that happen from blast injuries over time can create this chronicity in brain injury. If they had one single event, they may not have long-term impact. But oftentimes we see long-term impacts when someone's had multiple events. The other piece I want to say about chronicity is that it's not static. Someone with a brain injury has this kind of healing curve that's pretty steep in the first year, I would say 2 years, and then they plateau, as a medical kind of community would say. And when I say plateau, I am talking medically plateau. Their brain is healed to the point it's going to heal. However, they're always learning compensatory strategies, so they're always improving. But we also then, on the other side of that, we do see health concerns over the length of time someone lives with brain injury. So this is not a static picture. You're going to see ups and downs in terms of how someone lives with a brain injury. In terms of some of the data, I think, you all might be familiar, but we have gotten much better with kind of diagnostic criteria and increased vigilance when it comes to veterans than what we used to have. So some of the data out there's around 500,000 people, service members who have brain injury worldwide, and that is between the years of 2000 and 2019. So it's a pretty significant number of people. More than 185,000 veterans who use the VA for health care have been diagnosed with at least one brain injury. And I want to emphasize diagnosed because, again, oftentimes if there's other traumas going on, they may not get diagnosed. So that number could be much higher, or if there's multiple brain injuries over time. The majority of people that we're talking about in this data set are those who have had what we call medically mild brain injury, meaning that they had concussion or loss of consciousness or no loss of consciousness for less than 30 minutes. But again, just knowing that mild in that context is a medical term, it doesn't equate to long-term function and how someone lives with brain injury. One thing I did want to point out is that over 80% of the injuries are non-combat related. And I think that's important because what we find is that people are maybe in combat or in field and they come back, and that's when they're sustaining their injuries. And part of that is kind of a makeup of a veteran in some ways, that they're adrenaline seeking sometimes. There's a little bit higher risk taking that we find with veterans that lead to risky behaviors that then lead to sustaining brain injury. So just something to keep in mind. All right, next slide. Some of the signs and symptoms that you'll see with brain injury, and we'll talk a little bit about how these overlap, as Jill said, with post-traumatic stress disorder. And if you know somebody who's experiencing post-traumatic stress disorder, or you yourself have, you will recognize this. Some of the physical symptoms we can see following brain injury are headaches, dizziness, or balance issues. Oftentimes the vestibular system is affected by brain injury, whether it's a concussion or relatively seeming mild brain injury or more severe injury. And those things can be immediately following the injury, but can also persist beyond the immediate acute phase of the injury. In terms of cognition, we see confusion, memory loss, poor judgment. That's to name just a few. People have difficulties with attention. People have difficulties with language, receptive and expressive language. Also, following brain injury, we see emotional irritability, depression, and mood swings can happen. And again, these things can be an immediate response to an acute injury, but they can also last beyond that. I think when we talk about PTSD, it's difficult to sort out what's what, because as you probably have recognized, there are a lot of overlaps in symptoms. And so asking questions about brain injury and if someone sustained a hit to the head or experienced a brain injury is important. I think what's important, why that's important, is because when we talk about treatment, if someone has overlapping PTSD and brain injury, recovery is going to be more challenging. And there are strategies that a trained therapist can put into place to ensure if they're treating brain injury, that they're recognizing the trauma from the PTSD and addressing that trauma so that someone can then take on addressing the characteristics of brain injury, the deficits that they're experiencing related to their brain injury. It's almost like if you don't address one, you have to address both in order to have success with one or the other. So recognizing that someone has a brain injury, putting into place compensatory strategies to address the issues they're having related to their brain injury is critical for successful trauma care, and vice versa. Recognizing if someone had trauma, addressing the trauma, helping them to be in a place where they can be receptive to learning compensatory strategies will be critical. And so in terms of that, I would just say, when you're seeking support, be thinking about both of these things when we're talking about a veteran population, because often they go hand in hand, and seek support from someone who's trained to understand both of these issues. Next slide. Other care strategies that you can think of related to supporting a person who has sustained a brain injury, both those who have sustained, but also in preventing brain injury. So a big part of brain injury is prevention. We can do things to help prevent the initial injury, and we can do things to help prevent a secondary injury. Oftentimes, people who've sustained one brain injury will sustain multiple brain injuries, and it's just part of that recovery from the brain. A hit that might not have been a problem in the past, if it was your first time you hit your head, and you're going to recover fully. But the more we do that, the more we hit our head, the more we see kind of brain injury symptoms emerging. So we want to think about our environment in terms of prevention, but then also thinking about our environment in terms of supporting someone with a brain injury. We wanted some of the things you're seeing here, communication tips, being really clear. This will also help people who've had PTSD as well, but being clear and calm in your approach, repeating instructions when you're able to. Try not to give people more than 1 or 2 instructions at a time, because they often can't process that and take it in to put it into action, or they may have short-term memory loss where that becomes a challenge. Make sure you structure your routines to reduce confusion. People with brain injury, if they have memory issues, short-term memory loss, they rely on routines very much so to get through the day. And so anytime we put a wrench in that routine, we can throw them off. And then you can see agitation, you can see some different things emerging. So as much as possible, sticking to structured routines to reduce confusion and to reduce the burden of relying on trying to remember, because all of that is cognitive drain that make everything hard. Pacing activities and building in rest is really important. Most people with brain injury will experience fatigue, and sometimes it's not like I would say, oh, I'm feeling really tired, I need to take a break. What you will likely see is that someone's getting agitated, they're getting off track more, they're really struggling. That's maybe you then to say back to them, hey, it looks like you're kind of struggling a little bit, maybe we just take a quick break here. They may not recognize it for themselves. The other things that I would just say is just making sure you're validating the individual and giving them calm reassurance, letting them know that there are things that can be done to help support what they're struggling with their brain injury. And they are these kind of really simple compensatory strategies like this slide would say. Next slide. The other thing that I want to just touch on quickly, because it is an important factor when we talk about brain injury. Oftentimes people with brain injury gets misinterpreted that they have a behavior problem or they have willful behavior going on. And so we like our little T-Rex friend here, because you would not expect a T-Rex to be able to hang those curtains any further. That's not willful behavior. That's just their ability. And we see that with brain injury in so many ways and it's more subtle, obviously, than that, because oftentimes it's not about physical limitation. It's about cognitive limitations, that we get into this thing about, are they just being willful or is this a skill deficit? And so what we really encourage people to do is to take the lens first that this is possibly a skill deficit and not willful behavior. And so first, taking a step back and thinking about, do they have the skill to perform the tasks that we're asking them to perform? And if not, let's then talk about, how do we teach that skill? And so giving an example of that is, maybe they're not showing up for their appointments on time. Is it that that's a willful act, or is it that they just have short-term memory loss? They're not being able to remember when their appointment is, and they need help to learn how to use their calendar and reminders to help them get to that appointment. And then once they get in a routine, they get to the appointment. So just a quick note on that, because I think I just really caution people not to go to that it's a behavior problem first, thinking first about skill deficit. Okay, next slide. So when to seek further assistance. So again, there's a couple of things here for you all to keep in mind with brain injury. One is you may be working with someone who has not experienced a brain injury yet. Hopefully they never will, but that acute care. So if you are working with someone, maybe they had a fall, there's something that happened where they hit their head, you want to be watching for those acute signs of concussion. And some of those signs are that kind of foggy mental status, kind of confusion. They may have a headache. They may feel nauseous. If you see that with someone you're working with, it is important to seek medical attention and get care for that. The main thing you're watching for there is that those symptoms are getting better, not worse. If they're getting worse in a shorter period of time, within a 24-hour period, they could be experiencing a bleed to the brain or a hematoma or something that could be life-threatening. And so we don't mess around. We say just get them to a medical professional so that they can rule in or rule out any kind of brain injury or concussion or bleed. So that's kind of more that immediate care. And then if someone has sustained a brain injury and you're caring for them, you'll want to take some time just to kind of slow down the pace, help them kind of get back into their life as they know it. There's ways to kind of pace their return. When we're talking about people who've had brain injury long-term, again, remember we talked about that chronicity of brain injury, and the trajectory can be up and down. Sometimes we're going to see people have worsening symptoms over time after brain injury. So we're talking maybe they sustained their brain injury when they were in their 30s and now they're in their 70s. We may see some decline or worsening conditions. We just want to be mindful of any changes that we're seeing, such as changes in behavior, changes in ability to care for themselves, changes in doing the routine that they normally are able to do. The other thing that gets confusing with brain injury is aging and brain injury, because oftentimes those symptoms overlap as well. So you, again, seeking some support with that to understand, is this a sign of dementia or is this brain injury related? And that matters because how you provide supports can change. So that's when I would suggest seeking further care. Okay, and to wrap out our slides, we want to leave time for questions. We want to just leave you with some resources to consider. So many of you are here with the DAV Caregiver Program. We're excited to have you here. So you may or may not be aware that there's also a VA Caregiver Support Program, and I know that this information is going to be sent out to you after our presentation. So just be watching for some of those resources. The other resources that you may be less familiar with, there's a Brain Injury Association of America. And I want to just say most states, not all states, but most states have a brain injury association within their state that can be helpful to you as a caregiver to give you resources to help the individual you're providing care for. So you should feel free to reach out to them. And there's a locator here in the slide that when you get, you can click on. Same with us at NASHA. First of all, I'll put our website, or Jill, maybe put the website in the chat because there's a lot of resources in that website that can be helpful. But we have a state directory as well. So if you're looking for your own state resources, go there. We list both the Brain Injury Association resources and the lead state agency on brain injury resources. Some states have funding available for people with brain injury. Some states have waivers. There's all kinds of things that you might be able to avail yourself of by talking with the folks in those positions. The other resource that is really helpful is the Model Systems Knowledge Translation Center. They are based on the Traumatic Brain Injury Models Research Model Systems. They put together amazing fact sheets in lay people's terms, plain language, that can be both helpful to you as a caregiver, but also to the person with a brain injury to help you understand brain injury, the intersection of all kinds of things. So I would recommend exploring that website to some degree. And then if you know Spanish speaking, there are also specific Spanish language supports and resources available at this link that you can click on. And then the last one that I want to just bring to your attention, because we talked about aging and brain injury, is this aging guide. So you can get a better sense of what it looks like to be aging with a brain injury. And with that, I want to make sure we have a little time for questions, so I'm going to stop talking. Please feel free to throw your questions in the chat or.
And Judy, I'm going to just throw one that was introduced at the early part of the session. Terry from Washington said that she would like to hear, and I know you've touched on this, but how to care for her husband when activities are stressing him out.
That's a really good one. Yeah. I think if you're seeing somebody being stressed out, really the best thing to do is just take a break and stop. You can't, once you're seeing that, there's no pushing through it. All you're going to do is enhance and increase the agitation related to what they're experiencing. So just take a step back and say to them, let's take a break. I can see you're getting agitated, and then slowly reintroduce them into the activities. Unfortunately, it's just not like you can kind of push through it. Mm-hmm. The other thing is environment, just really setting the stage for success. And so thinking about, where are you doing the activity? Is it chaotic? Is there a way to minimize the chaos even before they start the activity? Thinking visually, thinking about sound, thinking about lights, all of those things can really increase that cognitive overload that their loved one is probably experiencing.
Another question, and something that might be really nice to start to close with, is tips to care for the self, as caregivers that have loved ones with brain injury.
That's such a good one.
Yeah.
You guys know all this all too well because you're caregivers, but as you can, I think you also have to build in a break for yourself. I think recognizing why someone is behaving a certain way in and of itself is actually a good stress reductor. I have a sister with a brain injury, and she was not diagnosed with a brain injury, and I used to get really frustrated with her. But once I understood why she was struggling, I could just kind of let go of some of that and just try to breathe through it and help her come up with strategies. But the reality is, it's just like any other disability or any other condition. You need to build in those breaks for yourself, trying to find a little bit of respite, making sure you're doing activities that help yourself, thinking about mindfulness in your own self, your breathing, how your body's responding, all of that. I think that those are the most important things.
And then just a couple of, there are a few here at the end that we might want to just put a few words to and share out with Hannah, but can any of this happen with premenopause was a question. And then any last tips about relationship changes when the person you're caring for has a brain injury? And I know we're down to the last 2 minutes, so.
Well, just real quick, I'll talk on it. Premenopause is probably going to exacerbate any brain injury related symptoms that were already being experienced, because there is a connection between estrogen and all those hormones and how we cope with brain injury. So I would just say it won't cause brain injury, but it will exacerbate brain injury as someone's going through that. So just be mindful of that. In terms of relationships, I would say check out the Brain Injury Association, because that is a big issue. Also, the model systems page that we put up there, the fact sheets, there's some guides to how to address those things. But I would say it's support groups. There's a lot of support groups out there across the country for spouses or partners or family members where relationships are changing as a result of the brain injury, and get support that way, or talk to a good therapist who can help you navigate that, because it is an intense identity change. And so just recognize that that is an issue. I'm happy to give you more resources if you reach out to or think that through a little bit more. Okay.
Great. Well, thank you again. We'll turn it back over to you, Hannah, for wrapping us up. And this has just been a great series. We're so appreciative.
Awesome. Thank you guys so much. This was super informative, and we loved the whole series that we had. there's been a few questions or comments that I've seen, and just so everybody knows, I am going to send a follow-up email, excuse me, with the recording, the presentation, all the resources. Jill and Judy's contact information will be in there also. So if you do have other questions, or just kind of want to touch base with them, feel free to do so. At that time also. We did put a survey in the chat, so if you could please take a moment to fill out the survey, it really helps us with other webinars and other events that we host. And then we also put in veteran-specific caregiver programs, like we said before. DAV Caregiver Support and the VA Caregiver Support Program are super, super informative. Great programs to get started with if you haven't gotten started already. And we just hit 101, so I will close this out so I don't take any of your time. So thank you so much, everybody, and we will see you hopefully at the next webinar.
And Hannah, before you close that out, one last thing. If you guys have any questions and you are connected with your TCare specialist or your DAV caregiver support specialist, please feel free to reach out, or you can reach out to Hannah or one of us, and we'd be happy to get you connected.
Yep, absolutely. All right,
Thanks,
everybody.
guys.
Have a great afternoon, and we'll see you next time.
All right.
Thanks, everyone.
Thank you.